Meeting this afternoon on this issue, the Health Minister, Dr. Joe Phaahla, has suggested he would like Cabinet to allow everyone over the age of 18 to get a vaccination. In other words, lower the age of people who can walk in to get a vaccination for COVID-19. As you know, it seems that the pace of vaccination is slowing. Dr. Angelique Coetzee is the chair of the South African Medical Association. Dr. Coetzee, good afternoon to you. I do appreciate the time. Thanks very much indeed for joining us. Do you support lowering the age of vaccination to 18 for COVID-19 at this stage?
Yes, I think we can safely lower the age groups to come into the vaccination space. We have seen that the uptake are not that great, so it means that we won't have these long queues. And therefore, if we don't have the long queues, we do have enough vaccines. We still have the sites that are open. And therefore, I think it's only prudent to lower the age group. It's not going to make a huge impact or put a burden onto the system. Anything not putting a burden on the system would be advisable.
We still just don't have a high enough percentage of people over the age of 60 being vaccinated. What do you think is the problem here?
I think there's various problems. We have talked about it quite a lot of times. One of the biggest problems is people are more hesitant. And because of a lot of fake news going out there, that I think
can you hear me?
Hesitancy is being, being fed by wrong information, and we have seen that our people quite like to rather listen to the likes of Facebook, social media, any of those things, than really go and read scientific articles, which makes it difficult because the average guy out in the street is not going to read scientific articles. They expect us to read it. They expect us to give it back to them in a language and in a manner that they can understand. So also 65 or 60 pluses, a lot of these vaccines or sites that are allocated to the people are not close to their homes. I've seen it with my own family, and it means you have to travel. Again, if you are old, you need to have transport. Older people doesn't like to go into inner cities. They need to get children to take them. It costs them money if they go and travel to get a vaccine. They have to travel twice to get the vaccine. So we need to look at all of that. The best thing would be to bring the vaccines to the people. Currently, we are expecting the people to travel to the vaccines, and it's not really going to happen.
Dr. Bridget Farham is joining us now, and Science and Medicine Editor, former editor at the SA Medical Journal. Dr. Farham, good afternoon to you. We've seen the pace of vaccination in other countries also going up and down. In Alabama in the United States right now, the percentage of people who are fully vaccinated is below 40%. Is there any reason to believe what's happening in South Africa, what's happening here, is different to what's happening in other countries that are trying to vaccinate people?
Good afternoon. That's a difficult one. I've been spending a lot of time in the last few days looking at vaccine hesitancy across the whole of Africa and not just in South Africa. Unfortunately, a lot of the best research is done here, but I think the issues are similar across most of our region. I suspect that the issues in other parts of the world are different because we have different demographics, we have different populations, we have different overall levels of education and access to information and access to vaccines. If you look at the surveys that have been done across Africa and in South Africa specifically, there was an extremely good survey done by the University of Johannesburg earlier at the end of December, January, in which they found that roughly 67% of South Africans were likely to have the vaccine if it was available. They looked at, which incidentally was lower than a global percentage of vaccine acceptance. They then looked at why people were not interested in having the vaccine. Things like the conspiracy theories and that kind of thing that are going around on social media at the moment were very low on the list of reasons why people might not take a vaccine. What people want, as Dr. Coetzee has just rightly said, is they want information. They want scientific information translated to them into public health messaging.
It's a vitally important conversation. We're discussing it. Cabinet's discussing it right now. We're going to continue with Dr. Bridget Farham and Dr. Angelique Coetzee in a moment. Vaccine hesitancy, what is to be done? Stay with us. Dr. Farham, Dr. Coetzee, it's Stephen here. We've got another couple of moments. We'll try to be as quick as we can. Thank you both for joining us. Dr. Coetzee, I'm going to come back with you, and I'm afraid we do need to discuss the doctors who are wrong. You know which doctor I... Welcome back. Well, Cabinet in discussions this afternoon, we understand, about lowering the age of vaccines in other words, access to vaccines to 18 for COVID-19. Dr. Bridget Farham, Science and Medicine Editor, former editor of the SA Medical Journal. Dr. Angelique Coetzee is the chair of the SA Medical Association. Dr. Coetzee, one of the people who could be seen as an influencer in society are doctors. The things that doctors say have huge weight in our society. Are doctors, do you think, are your members aware of that? And there is, of course, you'll know the example, one doctor who seems to be spreading untruths, things that are not scientific about vaccines. Are doctors aware of the influence that they have?
Yeah, you know, we all tend to focus on one specific doctor, but I can tell you there are quite a few more doctors that also are specialists and general practitioners having their own thoughts and belief system around vaccination. And I don't think they really understand the grave impact that this can have on their career if you start to bring your own personal beliefs to the foreground in a time like COVID-19 while we're falling under a Disaster Management Act, as well as your ethical obligations. So from SAMA's side, we are now trying to help and get the doctors to understand that me and Dr. Farham can sit and we can discuss what we think is going wrong or we have concerns. But when we speak to our patients, to the public out there, we need to make sure that we convey the message that is the scientific or based on good scientific grounds, with proven efficacy, with good peer-reviewed articles, that we can give that information to our patients. The choice must be, in the end of the day, our own patient's choice, but we have to give them the tools to make that decision. We are ethically obliged by the HPCSA rules and code of conduct to do this, because we have now been asked, can't doctors then have their own opinion? Yes, you can have your own opinion, but if you have your own opinion and you get a case against you or a complaint against you from the HPCSA, you will unfortunately have to go and stand in front of the HPCSA and bring your data with you. You'll have to prove that this was a trustworthy, scientific journal that you got this information from to prove your standpoint. If you cannot do that, you keep your own views and beliefs to yourself, and you do what is the right thing in the interest of the patient, especially when we are under Disaster Management Act and we're still in level 3. And I don't think the doctors understand this very well. It's not that you can't have an opinion. Yes, you can have an opinion. But you also need to make sure, where do you express your opinion? If you express your opinion on any social media, you have to assume that your opinion can be leaked and get into the public domain. And because of your position, because you are a medical doctor, having to account to the HPCSA, in the end of the day, you must make sure that what you say, you can prove.
Dr. Farham, there's an interesting thing around all of this. There's some dynamics that have been difficult for us to control or out of our control. I mean, I think the delays in Johnson & Johnson and the supplies of that vaccine, I think you could argue, were out of our government's control. What is in government's control is the communication, certainly. And I need to bring digital vibes into this. I mean, that scandal, we've seen that Dr. William Kize resigned as health minister as part of the digital vibes issue. Do you think that has been a complication in this? I say complication. Do you think that could be responsible for some of the communication problems we're seeing?
Yes. I saw a quote by Nicholas Crisp in a media article recently saying that there's no communication budget. If that's the case, then I presume that the money that Digital Vibes received that went on nail salons, etc., was the communications budget. And one of the points that I really want to make quite strongly is that there will always be disinformation. But if there's a credible, good, public health communication campaign out there at the same time, that disinformation will not have as much of an effect. So yes, the digital vibe scandal, the fact that our previous Minister of Health left under a cloud, the mistrust in government and the complete lack of communication that has come from government, the lack of transparency, is within our control and has not been handled well. And I'm sure that that has a lot to do with the current problems with vaccine uptake. And what I really want to see happening is for government to take responsibility for this and for people to be held accountable for what's going on. And instead of sitting there saying, oh dear, what are we going to do about it? Get off your backsides, and do something. We have the facilities, we have the people, we have the skills in this country. We have the money too, even though Digital Vibes used quite a lot of it. That communication program is absolutely vital. We have to vaccinate people. There is no other way of preventing the fourth wave from being as bad as the first, second and third waves.
Dr. Coetzee, do you think there's a sense of urgency in government? I mean, do you think the health department gets it? Do you think, and I mean, in a way I feel sometimes sorry for the health department. This is actually a social issue. We're doing something we have not done in living memory before, trying to vaccinate adults in our population rather than children. It requires an effort by all of our society, but government must coordinate it. They're the only ones who really can. Dr. Coetzee, do you think government gets how urgent this is?
I think certain people in government, especially National Department of Health, get how urgent this is. But, you know, due to failure through the years appointing people who are not sitting in the right positions, who do not have the skills, the right skills to handle this type of problem that we are seeing, is leading to, again, the chaos that we are, or that we have seen and also still going to experience going forward. You know, we have seen, and Dr. Farham is absolutely 100% correct, that we cannot blame the anti-vacciners for everything that's going wrong now. It is a comedy of errors that led us to where we are. And we should have been honest right from the beginning, right from SAMA's side. We kept on, and when the committees where I'm sitting in, I kept on saying, please, we have to be honest out there. Let's get the message. Rather tell them the truth and get it over and done with, than try to hide it and sugarcoat it. It's not going to work because our people are not stupid. So, yeah, to come back to the question, I don't think everyone understands the urgency. It's a teamwork. It should be right from the top down towards the cleaner in the system that needs to be on board. They need to understand the importance of this. It's not happening. Well, we have seen even the appointments of suitable people, nurses and doctors in certain of the hospitals. It doesn't happen. Although we all know that the fourth wave is going to come, and it's going to happen, and I can promise you the same inherent problems that we are sitting with is still going to have them. Of course, not everyone is on board for various reasons. We have to get the people on board. We need to say enough is enough. And either you do your work or you get out of the system. There's enough people, I think that's very well qualified out there, not having a job, that you can maybe recruit to take over some of the jobs of people who only have a seat and keep that seat warm.
Dr. Angelique Coetzee, Chair of the SA Medical Association, Dr. Bridget Farham, an editor and author in the science and medical space, former editor of the SA Medical Journal. Thank you very much indeed, both of you. I do appreciate the time. An important topic, Cabinet in discussions around this issue right now. The